National Coalition of 100 Black Women's West Palm Beach chapter, Community Health Education Talks. We would like to take the opportunity with this program to highlight health issues in our community.
And our lead champion for health equity. Welcome, Dr. Lewis.
I grew up without health insurance and knew firsthand what it meant.
Good evening. Welcome, Facebook family. My name is Charlotte Leonard, and I come to you tonight on behalf of the National Coalition of 100 Black Women. This is our health spot. We present this show to you monthly. We bring professionals from our West Palm Beach community to come live onto the health spot to talk to us about health issues that affect women and girls in our community. The health spot is meant to educate the community on how we can access resources and get better access to medical care as needed. I'd like to say that this month is Mental Health Month, and we have brought on a professional from the community to talk to us tonight about mental health and the resources available through her service. I, again, represent the National Coalition of 100 Black Women. We are a woman-led organization that is fully volunteer involvement. We have no employed females working for us, just volunteers. So tonight, I'm going to turn it over to my co-chair, Sabrina Cooper, and she will present and introduce our speaker for this evening, and they will take over the program and talk to us about mental health. Thank you for joining us, and let's go live, Sabrina.
Good evening, Facebook family and friends. My name is Sabrina Cooper, and I serve as the co-chair for the National Coalition of 100 Black Women in the West Palm Beach chapter. Tonight, I would like to introduce our speaker. Our presenter tonight is Patrice Schroeder, a community relations specialist for 211 Palm Beach and Treasure Coast. Patrice holds a master's degree in human behavior from National University, San Diego, California, with an undergrad focus in behavioral science from University of San Diego. She has been with 211 since August of 2006. She enjoys engaging with people of all backgrounds to educate them about the benefit of 211 as not only the central hub of information on resources, but as a life-saving service. 211 also provides several advocacy programs for different ages and populations as well. She also facilitates the interagency network meeting of Palm Beach County and serves as the president and the chair of the Glades Patch, which stands for Planned Approach to Community Health, the Patch organization, and serves on the board of West Palm Beach Mental Health Coalition. She also participates in numerous other community provider meetings, with a very heavy emphasis on hunger relief and the housing crisis. One of her greatest passions is to help connect the dots, bringing the community partners together for even greater collaboration. Facebook family and friends, let us welcome Patrice. Welcome, Patrice.
Thank you. Thank you for having me. I'm getting a little scratchy throat, so I'm going to dig on through here. But for those of you that aren't familiar with 211, 211 is a national initiative that started in the year 2000. The number 211 was FCC approved, just to make it easy for people to find health and human service programs. So we're talking about, meal sites, food pantries, free clinics, mental health care, job searches, all that type of stuff. We have those agencies in our database that can assist the individual in finding those resources. So the whole goal was to make it easy. It is also, Canada uses it, Puerto Rico uses 211, and it is also becoming global. So I think some parts of Europe are now using that as the go-to number. So it's just making it easy to navigate and find services. My agency has just celebrated 50 years. We've been here in Palm Beach County for a long time, and really started off as a crisis line and a substance abuse hotline. So, and then continued on and opened it up to be a general helpline as well. So our goal is to help people find those services. They can reach out to us just by dialing 211, and that's throughout the country, just dial 211, or they can also text. They can text their zip code to 898-211, online at www.211palmbeach.org. We do have chat available, so they can reach out to us via chat from the hours of 10 in the morning till 8 in the evening. So there's just numerous ways. And of course, we do have an email address as well. Anybody can call from any background. And just to kind of clarify, as we preempted the program, this is Mental Health Awareness Month. And usually mental health calls coming into 211 average about 30% of the calls that we get. Last year, we had over 100,000 total in 2021 of people requesting help, and mental health calls were a huge portion of that. I just looked at the statistics from January of this year till this day, and we're looking at roughly over 28,200 calls and contacts reaching out for help at 211. And of that, surprisingly, housing has kind of taken the lead on the need that we're hearing. So we had over 7,400 requests for help with housing, and that's no surprise to any of us when we're looking at the rental increases. We're looking at the houses that are being sold out from under people, and the hard, it's hard to get into a house right now unless you're a cash buyer. So we're hearing those stories of people that have had their rent increased by $500, $800, $1,000, and that's across all, income levels, interestingly. Now, mental health calls usually is the highest need. It came in at the second highest need, with over 7,000 individuals reaching out to help with, for help regarding mental health and substance use disorders. So I know last year we had close to 3,000 also suicide crisis calls as well. So on average, we have roughly 10 suicide type crisis calls per day. So we are in the trenches. And of course, helping to get the word out that a person can reach out to us if they just need to talk about their day. They don't have to be looking for services. They may be struggling. They may be a caregiver. The CDC recognized the fact that, the pandemic was the initial wave of crisis with the healthcare needs of the pandemic. And then following was the economic wave, the economic crisis. They knew that a much larger third wave would be coming, and that is the mental health crisis that we're seeing right now. So we do know that, suicide have gone up. We do know that, interestingly enough, the opioid deaths, I was looking at the current medical examiner stat, and it was last December, I think it was December 2020 to December 2021. Opioid deaths went down a little bit, but they're still the #1 cause of death in this county, I believe, as I was looking at that stat. So we know that people are self-medicating. We know that people may be turning to alcohol and other substances to kind of hide the pain or dull the pain. And we really want them to find mental health care, because they could get those tools to help them cope and navigate, and the strategies in place from a professional, as opposed to self-medicating, which is harmful in many, many directions. Interestingly enough, I think during the height of the pandemic, the #2 Google searches, #1 was a liquor store near me. #2 was French fries near me. And that kind of sums it up, self-medicating and comfort food. So, and, if we want to have the wider discussion on mental health, mental health is just as important as physical health, and they go hand in hand. And I think you were asking, let me bring up this. This was beautifully put. If anybody got a chance to look at the Facebook Live for the Get Your Green On kickoff campaign, Dr. Mary Claire Musinik with the school district, she did a wonderful job with her presentation, and she basically brought up this commentary that mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental health is our ability to live fully, engage with others, and respond to challenges. So I know we talked a little bit about Get Your Green On campaign for mental health awareness, and that the key theme this year is resilience building. And that is so important because we know, resilience isn't something you're just born with. It's something that you can build and develop. Just researching, go to the internet and look for resilience building. It's just basically finding that sense of connection, that sense of centering and grounding, eating right, sleeping well. People don't understand the importance of sleep, that if you're lacking sleep, that can impact not only your physical health, but your mental health, because your chemicals, your brain chemistry has changed. So that can contribute to a lot of underlying conditions as well. So just, COVID brought a lot of isolation, and those groups that were particularly, say, impacted would be the caregivers. A lot of family caregivers were very, very isolated, and seniors. So we can talk about some of the 211 programming regarding that in just a little bit, but with the mental health focus, I think right now with 1 out of every 4 adults is struggling with the mental health, and it's generally over the course of the lifetime, but we know with COVID, the impact has been great. And we know that those day in and day out stressors of just putting a roof over your head and feeding your family, that's compounding a lot. And that's driving some of our crisis calls too, particularly the housing concern. So it's just, how do we find that sense of balance? How do we support each other as a community? How do we remove the barriers to care? That's the big conversation with equity and barriers to care. So, and right here, you guys are just doing that wonderful piece and helping bring that conversation to the greater community. And that's sometimes what it takes, just having that conversation so we all understand that every single one of us is on the spectrum of mental health every day. Some days I'm way over here, some days I'm way over here, and some days I'm in the middle. So, but it's when you tend to kind of get stuck in one, the lower end of the spectrum, and you're not making your way, you're not feeling productive, you're just not feeling good about yourself and the things that are happening, that's maybe time to go ahead and seek a mental health professional. And of course, they can dial 211, and our staff will help them to navigate the services that are available. And we do have a lot of great resources in Palm Beach County. And for those we were talking about, young women, young girls, et cetera, most of the school campuses, the goal is to have a mental health professional on each school campus. So I know the school district has made great strides. So there's a good chance that a student, particularly middle or high, will have access to a mental health practitioner at their campus or school, and they can learn and ask and reach out for that help. We have some wonderful organizations, the PACE Center for Girls. They have, they're focused on young women that may be struggling with school, not succeeding. They have alternative education programs, but they also have community counseling too for young girls. I think it starts at age 8, but I'm not positive on that, but they are a good resource, and they do have that as well. And sometimes people are struggling with eating disorders, and that could be young women, but it could also be males too right now. So we have the Alliance for Eating Disorders in Palm Beach County. They are actually a nationally recognized organization. So we have like the best of the best here. And interestingly enough, people that are in the service, which I learned at a conference, can actually tend to, if they get into the scenario where they have an eating disorder, they're able to do it very well because they're very regimented and are strictly disciplined. And I didn't realize the impact on the military personnel as well. So females, males, but just very interesting. But the youth services with Palm Beach County is a wonderful organization for mental health therapy and care. So there's a variety. Fox Center, there's Catholic Charities also has mental health programs available. And of course, for general peer-to-peer, NAMI and the Mental Health America do offer some type of supportive programming as well. So it just depends on each individual's specific need. And we try to get people to a location that's close to them. So generally when somebody calls 211, we're asking about the zip code because we want to find them. A lot of people are transportation challenged, and the gas costs also. So, and always to let them know that there are still telehealth options available, so that if you don't want to spend money on gas, you're able to have a private corner someplace where you can have a conversation with somebody, and perhaps it could be on your phone in your car also. But that is an offering too, and you don't have to worry about childcare, because we have a lot of people that it's not just them, it's their family, and how do we make accommodations so that they can get the care that they need. I don't know if you have any questions for me at that point, but
I do. I just want to know a couple questions. What can one person expect when they call 211? What can they expect?
well, what they can expect now, generally we do have a prompt up front when they call, because we don't want them. We used to have an old time phone system where everybody is in a queue, a line behind each other. So we wanted to bring the crisis calls to the forefront, because if somebody's in a mental health or suicide crisis, we want them to get the priority. And then of course, if they're looking for other services, childcare, food sites, and things like that, they're not that high priority as that concern is. It may take a minute. The crisis calls are answered very rapidly, but if they're waiting for other services, I need a mental health provider, it might take a minute or two for staff to get on the line. Again, I also encourage them to text text or zip to 898-211. That's another way of getting into the system. But you'll be speaking to a live person who is highly trained. Our staff have over 100 hours plus training. We are accredited through the National Suicide Prevention Lifeline. We are accredited through the American Association of Suicidology, which you didn't know existed, but it's there. They have wonderful resources, particularly for the media when they're doing reporting on stories of suicide, et cetera. How can we report this without creating a copycat contagion factor? How do we do it without giving the method, just stating that there was, a person was struggling, whatever the case may be. But it's just a really good thing. We also are certified and accredited through the the Alliance for Information Referral Systems, so services. And here in Palm Beach County, we answer the victim services line for Palm Beach County. So we do take certification trainings for victim services, et cetera. So our staff are highly trained, over 100 hours again before they take the line by themselves. And they must answer all levels of calls. It could be something as simple as, gee, I need the number to the nearest library to me, or it could be, I need to enroll my child in school, or it could be a little more complicated. I just lost my job. I don't know how to feed my kids. Where can I find food pantry or meal sites? Or it could be, and sadly, this has happened a lot, people that have their businesses have been gone bankrupt, and perhaps if they had a spouse, my wife is wanting to divorce me. I just can't take it anymore. I just don't want to be here. I want to kill myself, so our staff are trained in all levels. And of course, the goal with a crisis call is to de-escalate that caller and to get them in a safe place. And have a contract for safety, reach back out to them if they'd like to do a follow-up call, or we can ask them if they want us to bring mobile services to them. So our goal is to make sure that they are safe, that they have been de-escalated, and that they're stabilized, and then work with the community partners to get them services that they need. And hopefully we want people to find a mental health care home as well if they're struggling like that. So with the average calls, of course, as you're hearing, we're going to give several referrals. We have an advocate now that can do follow-up to make sure. We generally try to give a few referrals at a time. And the situation is when they're calling to 211, they're not just getting phone numbers pitched at them. We're listening to what's going on in the family dynamics. We're assessing what the priority need is. They may think they need this, but we're going to tell them, hey, no, you really need to start here. You need X, Y, or Z first before you go to A, B, C. So it just depends on the scenario. So our staff will do that crisis triage. And then we're going to give them about 5 referrals. And then we can do follow-up. Hey, did you want us to check back with you to see how you're doing with those referrals? Because we can't guarantee, when we have about 1,500 agencies with over 3,200 programs and services. But once it leaves our hands, sometimes people complain, hey, I couldn't get through to, I couldn't get to the pantry. I couldn't, speak to the person at this agency. They weren't picking up the phone. You have to be very patient and persistent, because a lot of agencies are struggling, just like you in the community. They're trying to do the best they can to serve the population. It may take a little persistence in continuing to call, continuing to follow up, but eventually you'll get that, you'll make that connection. But it's out of our hands at that point. And, the criteria of that service provider, we do the best to kind of make sure that we're getting them the better referral, so that we're not sending a guy to a program that's for women and children. We're not going to do that. So we make sure we're looking at the criteria just to kind of give a ballpark, and then it's up to the provider to assess whether that person does indeed meet the criteria for the finances, et cetera, as some of these programs do have qualifiers. So that's a long answer. I hope that helped you out.
It was fine. So my next follow-up question will be, is there a physical place where someone can go to get help? If they call, it's 211 a physical place, or is there?
No, 211 is phone based. We are not a walk-in site at this point in time. So we average about 300 phone calls per day, and text messages as well. So our goal is to get them to a service provider that does have a walk-up site, or they may be phone-based to some extent, just depending. Or, a lot of people may need assistance with applications, whether it's even getting food stamps or things like that, the EBT card. So, we'll help them get to the nearest library that may have that service. That, libraries are doing wonderful work now. They're kind of picking up the slack when, let's face it, some of the governmental entities kind of closed down a few of their storefronts, and it was up to the nonprofits to really pick up the slack and help the community get in applications and things of that nature. And right now, I think the to apply for the EBT or SNAP, it does take a little bit of time, because they're the government is inundated and they're kind of backlogged a little bit. So it might take a little bit of time, but hopefully getting to a food pantry to help tide somebody over. If it's a senior, we're going to work with the agencies that can help them get the meals delivered, that kind of thing. Or if it's somebody with a disability, perhaps as well. So just helping in that capacity as we can.
Okay. So my final topic will be, you have an upcoming event that's happening this month, May 21st. Talk to us a little bit about the festival, so we can let the Facebook family know where they can come out and be a part of it.
And I don't know if I can screen share to bring up that flyer. Should I do that or no? But at any rate, I'm a part of the Mental Health Coalition. Let's see if I can find that open event. Let's see if I can do this. Are you seeing that?
Yes.
Okay. So at any rate, are you seeing the whole document?
It's stopping at the address.
Okay, so basically the West Palm Beach Mental Health Coalition is doing its 4th annual Family Mental Health and Wellness Festival. And I really wanted to have it to be a little more cheery than an educational conference. So I really pushed to have that wellness festival and make it very family friendly. But again, this is the 21st of May, which is a Saturday, and it really is going to be an awesome event from 10 until 2, as you're seeing. And we're going to have a lot of different vendors. And one of the nice things, the keynote, we have Senator Bobby Powell, we have Mayor Keith James of West Palm Beach will be doing an address as well. And they also invited Vice Mayor Weiss from the county to attend. And I'm not sure if he's going to be able to make it, but we have a lot lined up. We have speaking engagements on topics such as human trafficking, just people sharing their experiences with mental health services, praise dancers. We also have orators. So it's just really a packed day, raffle prizes, as you can see. And let me scroll down a little bit more. And there will be food and just light refreshments. And then we have a special contest. We're trying to bring the faith-based groups on board. So basically, whether, any denomination, a pastor, a rabbi, a priest, can bring their congregation, and the largest number, that congregation, that church will receive a little bit of a reward for that. So just trying to sweeten the pot a little bit and bring more on board with the faith-based. So it's just a wonderful program. So I'll just scroll so they can see that. So we will have a lot of resource tables there as well. Just a lot, and Digital Vibes will be providing the music. And for all of you out there, you know that if Digital Vibes is in the space, it's going to be a fun time and you will be moving. So you got to get your beat on and you'll enjoy it. So a lot of great things going on. And I think we can scroll back up. And then again, that's at that Salvation Army location in West Palm Beach. So bring your family on over and come and enjoy the activities. It's a free day of events, and a lot of good things will be happening, and a lot of good resources. And of course, the tables generally have some tchotchkes there that people can enjoy, the little free giveaways. So look for a nice, good family event. So looking forward to it myself.
Well, we thank you so much, Patrice, for joining us tonight on our Health Spot, and we really appreciate you taking the time out to provide us with valuable information about the mental health and the organization 211. At this time, I'm going to turn it back over to Charlotte.
Well, again, Patrice, that was very helpful. I think our community learned a lot tonight from you regarding 211. We're looking forward. We will also be participating in the Mental Health Festival on the 21st as volunteers. So we're looking forward to that. We hope we get a lot of people out. As you said, there will be a lot of organizations from the community attending that event. They will have resources available to the community. So we invite you all out to just kind of participate and enjoy the fun as Patrice talked about. So on behalf of the National Coalition of 100 Black Women, we thank you again, Patrice, for participating tonight. And our Health Spot, this is our last show for this season. So we end on the mental health note, but we appreciate you, Patrice, and we appreciate all that 211 is doing for our community. So everyone have a great night, and we'll see you on Saturday, May 21st from 10 to 2.
And get your green on May 19th. So wear green on May 19th, as you all got your green on.